There was a plan in place. The province made it a top priority.
Long-term care home staff were people who were first in line for vaccine.
So why is 35% of the staff at this long-term care home in Kelowna working without at least one dose of the COVID-19 vaccine?
I would expect that among those who haven't been vaccinated, there are some who have chosen not to.
A COVID-19 outbreak was declared at Cottonwoods Care Centre on March 7th. 11 residents and 2 staff have tested positive with COVID-19.
They do work in a care facility with older people, and they put them in jeopardy.
I don't know, it just doesn't make sense, you know.
They should get the vaccine because a lot of them are bringing it in.
Interior Health says it hasn't taken the time to figure out why staff at the care home didn't get the shot during phase 1 of the vaccination rollout, but admits there were multiple opportunities.
They would have probably had 2 opportunities at minimum.
BC's provincial health officer says some staff may not have been available, others downright wary about being first in line.
Many had concerns. They had legitimate questions about these new vaccines.
Vaccinations have never been mandatory in Canada, but employment experts say there are ways to respect a staff member's wishes without compromising the safety of vulnerable clients.
The employer is going to have to keep that person employed, but move them to something else where they're not interacting with that vulnerable population.
In fact, Interior Health does keep unvaccinated staff out of long-term care facilities when there's an exposure or outbreak of the flu. The devastating coronavirus, a different matter.
If we were to implement that policy right now, we would not have enough staff to operate the facility.
Interior Health says its current priority is giving the vaccine to those who want it. Families with loved ones living through another COVID-19 long-term care outbreak left to wonder, how is that part of the plan? John Hua, Global News.